Hi, I'm Dr. Roadhouse, and I want to introduce my patient, Dolores Messick. Dolores, when you came in to see us, you'd been diagnosed with lumbar spinal stenosis and had quite a journey before you came to see us. And you want to just kind of let folks know basically, how it affected your life. But talk about, first of all, the journey that you went through. You had spinal injections, you've had back surgery, you did physical therapy, you did spinal decompression in other doctor's offices. Kind of talk about the, the path that you had before you came to see us.
Okay. I love to play golf, and one of the first things that showed up was pain in my golf game. And I thought it was just the sciatic nerve. And so I didn't pay that much attention to it, but it continued to worsen, and so I began to search for an answer so that I didn't have to give up the game. And the first thing I did was I went to a doctor that said he could take care of this, and I was lying on a table and he was pressing something by my ear, and this was going to be miraculous. But
Okay.
It wasn't.
This is a chiropractor that you went to?
Yes.
Okay, all right. So the first doctor that you went to is a chiropractor that really didn't even address the lower back.
No.
They said they could fix it by working on your neck.
Mm-hmm. I was up pressing around my ears.
Oh, okay, all right, okay. And that didn't work.
No.
So then what'd you try after that?
Then I tried, let's see, what did I try? I've gone blank, Dr. Roadhouse.
Well, we know that you did 4 series of spinal injections. Okay, did you do the
Yes.
physical therapy before the injections or after?
I did the physical therapy after I had the operation.
Oh, okay, all right. So you actually had the series of 4 spinal injections before you had the surgery.
Prior.
Okay, all right. And you had a pretty bad reaction with the last one, didn't you?
Yes, I was paralyzed for about an hour
Okay.
or longer. I don't know. It scared me to death. I know that. And so then the pain continued, and I decided that it was time to have an operation. But before I had the operation, I kept thinking I was going to get over this, and so my husband and I went on this cruise, and we did some snorkeling, and I got stuck out in the water, and I didn't think I was going to get back to shore because of my pain in my lower back and my right leg.
So when you were out snorkeling in the ocean, all of a sudden your back just seized up on you and you had severe pain. Could you move your legs?
Not very well.
Okay, all right. And that's why you had a hard time getting in?
Yes.
Okay, all right. And so you did you have to get help, or how did you get in?
No, I just used my strength in my upper body to get to where I could get on the shore.
Okay.
But let's see, then from that, I determined that I needed to do something besides this, which was, I think, when I checked into having back surgery.
Okay.
And I had not heard of decompression at that point in time. I'm not even sure it was around.
Yeah, I don't think so.
And so I checked out the doctors, and I had 2 doctors that operated on me. One was a neurosurgeon, and one was
Right. Orthopedic, right?
Orthopedic, yes.
Because you have some hardware.
yes.
Right.
And so
What did you have?
I have 2 rods and 6 screws in my lower back, and the operation was successful, but it didn't alleviate the pain. I was able to move, but it took a long time. Then I had physical therapy after that, which didn't help.
Okay.
And so I went to a doctor that did decompression with
You did the DRX 9000,
yes,
right?
that's right. And it worked.
Mm-hmm.
Unfortunately, it just didn't last.
Yeah.
And so when my husband passed away, and I don't know if it's a stress or what, but anyway, I needed help again. And so I searched for someone like Dr. Roadhouse and found you, and via a friend of mine. And talked about what all was gonna happen. And I didn't have insurance to cover work that we were gonna do, and it was terribly expensive. But then I figured if it could help, expense was secondary. And so we began to work on it, and I'm able to, as a result of, what was it, 6 months or so,
Okay.
maybe, I don't, I'm able to go back and golf. I'm able to walk and take my dog for a walk and do things that I used to do. I can't bend
Yeah.
like I used to, but
Well,
that's because of the metal.
You're not gonna be able to because you have 2 rods and 6
Right.
screws. But the thing that's changed is, you know, like, you like to walk your dog, you couldn't do that when you first came in.
No.
You know? And then you wanted to golf, and now you can golf and finish the game and do well at golf and enjoy it. Because before you could do it, sometimes you couldn't finish,
Right.
but other times it would flare up on you, so it wasn't enjoyable.
That's
you know?
right.
And what about sleeping? How are you doing sleeping?
I'm doing great sleeping.
Yeah.
That was another thing I didn't do well at all, for sleeping on that. I was prone to sleeping on my right side, which was where all the problem was, the stenosis and stuff. But I'm able to sleep well now.
Okay. And one of the things that's, you know, that we visited, because you had, you know, 4 series of spinal injections, and the spinal injections, did any of them give you any relief?
No.
Okay, all right, so you didn't have any, and then you had the 4th one, that's your paralysis. Okay, so after having that, doing the surgery, doing the physical therapy, and then the decompression, you remember that I said, for me to be able to help you, it's gonna have to be a problem with the cerebellum, because the cerebellum controls the cervical musculature, the musculature from the skull all the way down the sacrum. If you're gonna do decompression, you have to be able to do a full decompression like this. And if you have a cerebellum problem, then it's gonna decompress it more like this. So you can't get a true decompression. So if someone else has had decompression and they haven't responded, or they responded and then it came back, it's usually a cerebellum problem. So we'll only accept the patient if there's a cerebellum problem. And you remember we talked about that, and then we did the testing, and we found out, you know, it was your cerebellum, and since then you've done fantastic, and you've been doing great for months now.
Yes.
Yeah.
I did notice the difference between the 2 decompression doctors, you and the other one, was that you use oxygen,
Right.
which was not used before. I don't understand all that, but you do.
Yeah, well, the oxygen, I mean, number one, it stimulates the brain to start functioning. It helps speed up the healing process. And what we do here, the other thing that we do that you didn't have at the other doctors, we also do the flexion distraction. Remember when you're lying on your stomach and the vertebra are, you're laying on your stomach, and I hold the one above, and the table flexes down, and that also pumps the disc. So between the oxygen, the cerebellar treatments, and the spinal decompression, I mean, that's what's giving your life back after spending a lot of money and a lot of time on other methods, and now you've got your life back.
Well, and one thing I'd like to say is that I no longer take pain pills. And after having surgery, I was on hydrocodone, lots and lots of it. Fortunately, I don't have an addictive personality, so I didn't ever get addicted to them. But I was taking a bunch of them because the pain was so great.
Yeah.
And I don't take them any longer.
Yeah, so you've basically, I mean, feeling great, and you're happy you did this, and this is a good
Yeah.
experience for you.
Yeah, this has been
Okay.
wonderful. I'd recommend it to anybody,
Okay.
and have.
I know you have,
In
thank you.
fact, my good friend Bill Bugman is here because of it.
That's right, and he had surgery that didn't work, and he's doing great too. So I appreciate referrals, and I enjoy taking care of you, and I appreciate you helping other people find out about this type of a treatment, because it might change your life like it did yours.
Amen.
Okay, thank you.